Hi, good morning. So, I thought I'll share a very interesting case that I came across in my OPD. This was a couple who were married for about 7 years, and they've had their initial evaluation outside, and all the evaluation showed that the man did not have any sperms in his semen. So, they were actually advised for donor insemination with donor sperms, and because the donor IUIs failed, they came to me for further evaluation. And when I looked at the couple, especially when I looked at the man, I could see that there was no facial hair, and he looked a little more towards the feminine side, and there was no actual secondary sexual characters which I could make out when I examined him also. So what I asked for was a repeat semen analysis and some of the hormones, and I found that it was a hypogonadotropic hypogonadism. So just let me explain how the male reproductive system works. So your brain releases some hormones into your bloodstream, which goes and acts on your testis to produce sperms as well as testosterone, and this testosterone goes back and tells the brain that there's enough amount of sperm and testosterone being produced, so you can reduce the amount of hormones that you are secreting. So this is called the negative feedback mechanism. So you always need your brain to produce these hormones for your testis to start producing your testosterone as well as your sperms. So for this particular patient, when we did further evaluation in terms of an MRI brain, we found that the place where the hormones are produced, the pituitary gland, is actually present in a place called sella turcica. So this sella turcica was empty. So his hormones from the brain were actually nil. So that is the reason why his testes were not producing sperms as well as testosterone, and therefore he did not have any sperms in his semen. Therefore he did not have any secondary sexual characteristics. So this sort of evaluation should have been done initially to give them answers and to give them options as to what they can do. So now after doing all this, what are the treatment options for him? We can give him the hormones from outside in terms of injections, and these injections will help the testis to produce testosterone as well as sperms. So these injections will be given over a period of 3 months to 6 months until the sperms start appearing in the semen and his testosterone levels go up, and then depending upon how the count is, we can take them for IUI or ICSI. So this couple actually have the capacity or the potential to have their own genetic baby, and had we not done all this evaluation, we would not have found out the reason for why this was they were not able to conceive, and we would not have been able to help them. So this is a very classical example of not to skip the basics in terms of examination, in terms of following the appropriate investigations, and in terms of offering options to the patients regarding what they can do, and then letting them choose, letting them be the decision makers rather than you giving them what you would want to do for the patient. So I hope that this video was very useful for you, and I will also share some of the the investigations and the MRI reports after the video is shared, and you can go through it and you can comment about what you would you think about this. Thank you.